I have a great fondness for the last speaker and this man too, because they're probably the two main people that really have kept me in this academy and made me try to be smarter than I am, believe me. And so Bob's been like a dad to me too. And I mean, there's too many accolades to mention. You want to Louisville? I know that. What else? You were major pain management, TMJ stuff, orthodontics, everything, and been on the board. Did Phil talk about the school at all? Did y'all talk about the IAOMT at all? Well, let me put a plug in real fast, okay? So my name, well, I guess it's not saying on here, but I got my NMD through this academy, through these two guys. So they've got a school. It's the American College of Integrative Medicine and Dentistry. It's about an 18-month program, but it's like 6 weekends over 18 months, right? Top speakers in the world are there, and you learn about everything. And when you finish, you're a board-certified naturopathic physician, which is what I am now. And the experience is unreal. I mean, what you're learning here is incredible, but I'm just saying there's more levels to go to. And these two guys are the guys that run the school, along with Karen in the back, Phil's wife. And I'm blessed to be one of the speakers, but there are way smarter people that teach there. So I think look into that for sure. Maybe just do a little mention at the very end.
Okay.
Okay, but this is he's the master. So Dr. Robert Harris.
I always try to do things in a baseball metaphor because that's what I did when I was younger. Played a lot of baseball. So you guys have been part of a 9-inning game so far. So the first 2 innings were pitched by Dr. Palmer, then Dr. Virtue pitched a couple, then Dr. Cole pitched a couple, Dr. Malika pitched a couple. That makes 8. So they bring in the relief pitcher and give me the ball. So we're going to finish it up here. And so what we're going to talk about is how we're going to integrate biologic periodontal therapies into our practice. 3 years ago, I was introduced to the concept that this could be an autoimmune disease. And I went, yeah, right. And then these people started sending me, these are other dentists and patients sending me all this stuff. And I started reading it. I said, well, this is peer-reviewed literature. How did I miss this? So, but we wanted to incorporate it into the mission of the Periodontal and Associated Soft Tissue Committee of the IAOMT. So, because we want really good outcomes for our patients, but I want them for me because I don't want to listen to them. I want them to get better and go away, and come back for their recall. So, just review the official position of the IAOMT, and we're going to review the integrated biologic treatment procedures that support the IAOMT biocompatible perio treatment. So, it's been a long educational day. So let's wrap it up. And, whoops, this is a little quick on the trigger. So, you heard from the first 2 lectures this morning about mercury. So is it okay? No. Get that stuff out of their mouth. Don't use it. And 2, what about fluoride? Well, Dr. Cole told you all about fluoride. Avoid it. I mean, look at the amount that's in the Crest toothpaste. But I got in a big fight with a Colgate rep probably 10 years ago about this. Triclosan. I said, you can't put that in your toothpaste. That's terrible for people. Oh, no, it kills the parasites in their mouth. I said, no, it's a pesticide. And someone went on about that because I tend to be a little bit of a nerd for detail and stuff. So anyway, but look, it possibly disrupts hormones and the immune system, which is what we're going to talk about today. Okay, now, finally, after everybody screaming and hollering for about 10 years, the FDA said, you know what, we better take that out of there because we're pretty sure it could be bad for people. So they took it out. So, and then number 3, the autoimmune component of perio disease. So that's what we're going to talk now and blend in what Dr. Malika talked about with ozone and everything and how we handle this biologically. So is it okay to have an autoimmune disease in our mouth or in the periodontal pocket? No. And so how can we figure that out? Well, luckily we've got a lot of really smart researchers out there. And it's really amazing what they've done. But they found out that these things formed in the thymus gland called regulatory T cells, they suppress the response, the autoimmune response in our body when certain bacteria hijack our immune system and all of a sudden we can't tell our bone from some invading bacteria. and we start making inflammatory cells and things in there to break this down. And the ones that promote it are called T helper 17 lymphocytes. Now, this will all be on the test when you all leave today, so I want you to take notes on this, okay? So this is what they're finding out, and this is what's really important. And I'll tell you, the perio has it's just been crazy. My hygienist says, well, we should have been doing this 15 years ago. I said, no, but we didn't know 15 years ago what we needed to do. So, but it's immunomicrobial pathogenesis of periodontitis. Well, okay, that's a mouthful, but what happens is you get dysbiotic microbial communities of keystone pathogens and pathobionts, and they're thought to exhibit synergistic virulence where they join together, and it's not 1 + 1 is 2, it's 1 + 1 is 15, because they increase that virulence when they get in there. And it's a self-feeding cycle there, and it escalates not only what we have to deal with in the mouth, but what our patients have to deal with in their gut. And we can help them with that, but it's a little bit difficulty coming from a dental standpoint, like Dr. Cole said, we're all naturopaths too, so we all have an NMD. So there's a little freedom that we have there to talk to the people about other things, like their gut and stuff, and how they can help it. So, but in this article, they highlighted the knowledge required for an integrated picture of the interplay between the microbes and your innate and your adaptive immune system. So, what do we really want to know about this? Well, it's what they talked about early this morning, the mercury and everything. Is that somehow connected to inflammation and to chemicals and chemicals to inflammation? Well, yeah. And what are they doing? They're attacking our immune system. So if our immune system is like this castle here, well, we've got to protect that. That's our body, okay? So what's attacking us? Fluoride. Oh, well, we don't use fluoride toothpaste. Oh, yeah? Well, you're drinking fluoride water sometimes. And what else is in that water? All kinds of stuff, man. I mean, some of these new drugs, they can't even get out of the water supply. So if you don't have your own RO unit or a distiller or something, a deionizer, you're really drinking some pretty nasty stuff. And so mercury, metals, and toxins in our mouth, that's bad. And then microbes, we're constantly bombarded with them. And I've had just unbelievable number of patients the last week or so with the stupid coronavirus thing. I want to come in and do ozone. Can I do it today? And well, let's see. And they're back there for filling, and I'm saying, well, yeah, I guess so. Go ask Kayla. We got 2 ozone machines set up, and we've got ears and nose, and really how you do the ozone treatment on people. But we were there till 7 o'clock the other night because the people were just begging, well, I just want to do it because I think I was exposed to it and I'm sick and I don't feel good and all this kind of stuff. So the ozone machine will knock it out. These people are, they know it will because I had a nurse that had MRSA. Her husband's a urologist. She had MRSA in her sinuses. They'd been treating her for 10 years for MRSA. Couldn't get it out of her sinuses. 3 treatments with ozone, gone. Went and told her husband. He said, oh, no, come on, look, they cultured her. It's gone. It's never come back. She comes in once a month or, maybe 8 times a year and just reboots her treatment with it. She spent so much money at my office, I told her, buy your own ozone machine. And she says, well, I kind of like to come in and hear what you're saying to all the other patients. So, because, you can my voice will carry even in my office. So I'll talk to people about these other things. So here's what we're dealing with, the immune system. It's our ultimate line of defense. So we have the external immune system, as described in this slide, as what we're covered with, our skin, our mucous membrane, nasal hair, and then we have the internal, and that's our lymphocytes and our phagocytes and our natural killer cells, and the lymphocytes go into T cells and B cells. And what's really important here is, I can find my little laser, on the second line of defense, when the phagocytes phagocytize a bacteria, they will activate and send information, like Dr. Malika said, over to the T cells. They receive the message, the information from these guys. Then they make an antigen out of this bacteria and send it to the B cells. The B cells then produce an antibody. The antibody then stores the memory, and if you're ever exposed to that vaccine, to that microbe again, you have vaccine-like effects. They can't hurt you. You've already got them built up there because you can identify them. Your immune system has the information to identify them. So another slide, which shows pretty similar, is innate versus adaptive immunity. But I wanted to put this one in here too because right here, the timeline. Look at the timeline. You've got 12 hours that are innate immune system to work, to kill these things. If it doesn't, then it goes over and you go into your lymphocytes. And these are the T lymphocytes I was talking about earlier, and those differentiate depending on what your body wants them to do. The prime differentiation occurs in the thymus gland. If your thymus gland is dysregulated, you're not going to make the good T lymphocytes, the regulatory T lymphocytes, that's going to protect your system. So this is one really underserved part of nutrition, as far as I'm concerned, is upregulating the thymus gland. So this is what Dr. Malika mentioned earlier, and this is something that I think really we didn't know hardly anything about until the last couple years. And these are microbiomes, and like there's 90% of our DNA is microbial. The other 10% is us. So who's driving this bus? Okay, so if you have all these microbes in there, and you have a plasmid in here, and the commensal bacteria can develop a resistance to antibiotics, metals, or other environmental stressors. One way they do this is they're exchanging fragments of DNA called plasmids. They can also transfer resistant genes packaged in viruses or acquire segments of DNA released from dead cells. What are they doing when they're making the flu vaccine every year? They're guessing what virus is going to be involved. Then they're attaching it to another virus, which who knows where they're going to get that from. And then they're injecting it into us, and they're hoping that they hit it right and that our immune system will work. Well, the problem is these plasmids can carry different genes conferring resistance to multiple agents, which means bacteria can be resistant to stressors they haven't even encountered. So if you have a MRSA bacteria in your system and it suddenly transfers to another bacteria in your system that's a normal bacteria, now that bacteria is resistant to antibiotics. They're getting pretty tricky, and we have to get trickier than they are, okay? So I know you're all sitting there thinking, oh, God, Harris, come on, shut up. Show us the science. You know, come, I want more, I want more. Yeah, right, okay. But, well, okay, since you ask, we'll do a little bit more. Anything that's set up here, and most of Dr. Cole's stuff and Dr. Malika's stuff, comes from PubMed. If you guys really want to know something, you're sitting around and you can't think of anything else to do on Friday night, and you've run out of bourbon and you don't have any ginger beer to make you, a Southern meal, which that's what we drink in Kentucky, So if you haven't had one of those, you ought to try it. Ginger beer and bourbon. And get a nice bourbon like Maker's Mark or, don't get the bottom line bourbon. Get you a nice bourbon, 86 proof, kind of smooth. Mix that with ginger beer and a little lime, and that's a good drink. But anyway, if you're bored and you don't have anything to do, go to PubMed, okay? And then it's got a search engine in there. Just go in and search something. So search ozone dentistry. 734 articles on ozone dentistry. And people say, well, I don't know anything about ozone. Well, it must not be, it's not a big deal because nobody ever talks about it. Well, a lot of people talk about it, but there are 200,000 of us out there, dentists, and we've gotten to about 2 to 10,000 people maybe. So that's just scratching the surface. I've spoken at the Kentucky Dental Association, Indiana Dental Association. They invited me back to the KDA for next year. It's getting out into the real dental world now, but it's just been a slow process because we learned about this in 1998. And we taught our first course in my office in Louisville in 2002. We worked on it 4 years while we were at Capital University, which is the integrative medicine school that both Phil and I attended. So let's look at this now and consider where we live and what we do and what makes a healthy tooth and gum and what makes a bad one, a diseased one. Well, look, here we got the healthy bacteria over here. Our body handles those. It recognizes them. That's our natural microbiome, okay? And look what's happening there. Those are regulatory T cells there. Those are the good guys, okay? They've got the white hats on. These guys have the black hats on. The T helper 17 cells, those are very bad boys, okay? And they will set up an inflammatory process and make your body not recognize itself and start breaking itself down, which creates, down here, bone loss. And these people come in and you look at them and you say, why are you losing bone like this? I mean, these are young women. Now, normally, I'd say probably 80% of the patients I have this trouble with are women. So, is this hormonally mediated? Could be. We don't know enough about it yet, but we know how to fix it, hopefully. And so what we want to do is, if I can get this thing to fire off here, there you go, T helper 17 cells as pathogenic drivers of periodontitis. Okay. More recently, the crucial role of Th17 cells in the regulation of immunity and protection barrier sites has been unveiled. I mean, look, when is this? Do you see when this is written? 2019. So this is new news, guys, okay? And so, and in the present work, we review the available evidence regarding the T helper 17 cells in health and disease with a focus on the oral mucosa and their role in periodontitis pathogenesis. So, oops, that is a little quick there on that trigger. T regulatory suppressive functions and T regulatory cells have special suppressive mechanisms that may inhibit different cell types. That's what we want to do. We want to inhibit the cells that are breaking down the bone in our mouth and causing autoimmune reactions in the gingival tissue that then progresses through the rest of the body. Because like Dr. Malika says, we are one, okay? I mean, the mouth is part of this. We got separated a long time ago by some morons that decided medicine and dentistry should be separated, okay? And it's a mistake, which limits what we can do because it limits what we're licensed to do, okay? And so, but when you look at this, these T regulatory cells suppress the pro-inflammatory functions of T effector cells, such as T helper 17 cells. Now, all this stuff, you know, rattle this stuff off, and all, I think you need to know the science behind this in order to feel comfortable when you're treating it. I've never felt comfortable knowing how to do something if I don't know why I'm doing it. So that's the same way it was when we started with ozone treatment a long time ago. And finally, T regulatory cells may promote tissue repair through the production of amphiregulin. It's a ligand of the epidermal growth factor expressed in epidermal cells and other resident cells. Why is that important? Here's why. If we can get it to work here. There. Okay, so here's your T regulatory cells, and it also has a FOXP3 protein, and it's got a slide coming up. We'll explain that one. But here's your amphiregulin, comes off here, and then it goes down here, and you have your epidermal growth factor receptor, and guess what it's doing? It's repairing us. It's fixing us, okay? We need that. We need something that's going to fix us. And this isn't putting a Band-Aid on it. This is turning our whole immune system around and turning the bad stuff off. So here's your tooth again. Here's your bacterial plaque and its biofilm. And these are lipopolysaccharides that are secreted by the bacteria that go in and cause differentiation in these T lymphocytes and the polymorphonuclear leukocytes. Everything here. The gingiva starts knowing this is wrong. It starts putting out antibodies to try to fight it from the plasma cells. The plasma cells are secreting antibodies which produce hydrogen peroxide and ozone to stop this. But right here, we've got these osteoclasts that are totally confused and they can't recognize us anymore. And they say, hey, this isn't us. Let's get rid of it. So these T cells need to be regulatory T cells, or Tregs. And the Tregs neutralize the bad guys, the Th17 pro-inflammatory cells. And in doing that, they neutralize the osteoclasts that are causing us to have these perio issues that we can't figure out what the heck is going on. So we have this thing called a FOXP3, and then the regulatory T cells in autoimmune disease. And so the regulatory T cells represent a cell type that promotes immune tolerance, okay, to self-components, our own components, and maintain the immune system homeostasis, balance. That's where we want to be. We want balance, and we want information from our body and from the things that we do for our patients to put us back in homeostasis. Because homeostasis basically deals with your cells. So if your cells are out of balance, they aren't going to make healthy tissues. If your tissues are out of balance, they aren't going to make healthy organs. And if your organs are out of balance, you sure aren't going to be a healthy organism, okay? But they're finding now that T regulatory cells can be used to treat autoimmune disease. So, is this battery going bad on here? There. So that went backwards on me. FOXP3 gene and the FOXP3 protein. Okay, the gene provides information to produce a protein. You need good information. The protein binds the DNA and regulates the immune system response. The protein is a transcription factor for production and function of regulatory T cells. Oh, you're going to put some in there? Okay. And the that's okay. And so what goes on in there is you have all these real complex interactions that are way away from what we would normally do with our normal treatment for perio. Thanks, Dave. Okay. Nope. Oh, is it on?
I don't know if I turned it off. Maybe not. I got it off.
Nope. Oh, wait.
Just try your
Okay. There. Okay. There we are. We're back. Okay. Got it. Okay. So, so what we want to do is prevent autoimmune reactions. Okay. And the protein is found primarily in the thymus gland, where T regulatory cells are produced. What does this T regulatory cell do? It's identifying bad things from good things. It's identifying us from not us. Okay, so that's why you want to do this. So this is, like, I think really an overlooked part of what we're looking at as far as the patient goes. So here's the patient. So they come in. Oh my gosh, like Phil said, what do they have? Perio, yeah, they're in perio. Ortho appliances, a lot of inflammatory change, all the steel and nickel and stuff in the bands. We got mixed metal, base metal crowns. We got fluoride on them. We got root canals that are failing. Mercury filling still in there. Dental implants that may or may not be good. And then you got to deal with the patient. What are their genetics? How are they going to handle this? How's their immune system? Their epigenetics, their lifestyle, and the quality of care, which deals with how are they handling the oxidative stress and the inflammation, which then leads to immune dysregulation. So this is this big cycle that we've got to deal with our patients. So when you look at the oral and the GI microbiome, we swallow over 1 trillion microorganisms a day. And the oropharynx is feeding the GI tract, and there's 50% overlap between your gut and your mouth as far as the species that are found there. And to prevent and/or treat oral dysbiosis, we really need to balance a lot of this. Like, what if they have a dry mouth? What if their pH is really, really low in their mouth? I mean, that's a killer right there, low pH. Too much sugar, too much acid production, and you just set up all the lactobacillus acidophilus in there, just grabbing that sugar molecule and breaking it down and making acid. So if you don't have good saliva flow and your diet is affecting the pH here and your home care is off, nothing we do when they're in the office is going to help them. It's like they come in and say, I want to do this. I say, okay, we have to do this, this, and this. Well, I don't want to do all that. I said, okay, so if you were a car and you brought the car into me, I'm the mechanic. You say, hey, what's wrong with my car? I said, oh, well, your front end's out of alignment. Your tires are wearing unevenly on one side, and your shocks and struts are out. And he said, well, can you fix it? Heck yeah, I can fix that. So you put new shocks and struts on, new tires, and you get the front end lined up. And you don't know, that guy's taking that and driving it off-road. It's a regular car, but he drives it off, and he comes back 6 months later and says, hey, everything you did on my car is all messed up, man. I spent all that money, and it doesn't work. And I look at it. How could that be? So where you been driving this thing? Well, just, my house is located back up a holler. Now, I'm from Kentucky, so this is not unusual, okay? And there's no roads sometimes. They'll drive up dry creek beds a lot of times. People, you have to, if you ever want to see how they really live, watch a TV series called Justified. It's on Hulu now, and I think it's also on Amazon. But that's Kentucky. And but I look at that in people's mouths, and they come back, oh, this filling you put in 6 months ago, it's broken now. You should put that back in free. I say, oh, yeah, look at the chart. Large broken tooth. Can talk to patient about core and crown. Patient declined, would like to try another filling. If next filling breaks, they will need a crown. You need a crown. I told you last time. She said, well, can I just get that filling replaced again? No, it's nothing to hold it to. So, but they're trying to lop the blame off on us a lot of times when it's not us. We're telling them what they need. It's them. Like I was talking to Ingo Mon last night, Dr. Mon, and he said, I had this patient, Bob, you're not going to believe, they came in and they had these 2 abscessed upper left molars, and I just said, hey, you got to get those out. Those are really infected. He said, well, I'm just going to let them fall out on their own. What? Yeah, it's just the body will take care of it. I'm going to let them fall out on their own. He said, I need you to sign something here on your chart that says patient declines. But these people, I had a lady tell me she's going to cure all of her kids' decay with magnetic clay. I said, okay, you've got a couple of abscesses on these deciduous teeth here. Magnetic clay's not going to fix that. Oh, yeah, I read on the internet it would. Okay, so you're going to run into strange stuff like that. So your human microbiome is immense, okay? You've got 600 species in the oropharynx in the mouth. You've got 1,000 on the skin. You've got 25 in your stomach. You've got 500 to 1,000 at least in your large and small intestines. And you got 60 in the urogenital tract. It's huge. Look how many, and we're living with them. We've got to exist with them, okay? So the mouth, a mirror of health or disease. When I was in dental school, the one guy told me, he says, yeah, boys, he said, I'm going to tell you, now you look in them mouth, you ain't going to see in there, you're going to see spots on their cheeks sometimes. That's going to mean they's got measles. They's got measles? Yep, and them's called Koplik spots. That's it. And he says, you know what else you can tell? And women come in, they got those puffy gums like that. You say, hey, I bet you're pregnant. And he said, now, you better not do that to everybody, but if they're a friend of yours, then you might want to do that. But, you can tell a lot from looking at somebody. Look at their tongue. Look at their buccal mucosa. And look at that. And you'll see they're not healthy. There's got a lot of inflammation in there. Mm-hmm. So problems in the mouth are mirrored in distant organs and cause systemic disease, the oral systemic effect. Okay? It can cause joint failures in prosthetic replaced joints, heart problems, strokes. Delta Dental and Aetna now in Louisville and Kentucky have gone to allowing 3 cleanings a year because they found that the people that were good with their hygiene and keeping up everything had like an unbelievable lesser amounts of strokes and heart attacks. Stroke and a heart attack is a lot more expensive than an extra cleaning once a year. So they're starting to look at this, the other professions. So meaning, insurance as well as the medical. Inflammatory bowel disease and periodontal disease often are present as comorbidities, okay, and have been investigated for similar immune pathogenesis. For this reason, the people that wrote this PubMed article suggests treating the local inflammation in the mouth and systemic inflammation as a way to treat inflammatory bowel disease and periodontitis. I've always told my patients I've got a license to drive a car because they'll want me to inject stuff that I'm not legally able to inject. Do I know how to inject it? Yeah, they'll say, can you inject this trigger point here? No, I can't. Oh, I know you know how to do it. I said, I know how to drive a bus. But if I get caught driving a bus without the proper license, I'll get arrested. Don't ask me to drive a bus when all I've got is a license to drive a car. Because I'm not going to get arrested, to help you. I'll send you somewhere else, Send you to Dr. Cruz. He'll inject you. He's one of my physicians I refer to. But you just got to watch out for those people because they'll want to get you involved in treating other parts of their body when we're not legally able to do that right now. So what are we as dentists contributing to overall toxic burden of the patient? Well, look at that. Should we treat that? Yeah, I mean, look, that's probably down on the pulp. Now we're going to have to, clean that up, ozone that, and what I'll do is indirect pulp therapy on it. Tell them, hey, we're going to probably have to maybe do a root canal or take this tooth out, depending on how you feel about endodontics. But we can try indirect pulp therapy, and so we'll ozonate it, and then we'll do, pulp protection on there and fill it and cross our fingers. Now, what about all this stuff in here? I mean, yeah, endo, you got crowns, porcelain fused metal crowns, you've got mercury. I mean, do we need to treat that? Well, yeah, but what about that? I mean, you have people come in like that, and they say, my gums have been bleeding. Oh, yeah? Well, you need to brush your teeth. Oh, I can't brush my teeth. They bleed too bad when I brush them. Okay. Really? Okay. So, so we need to get with the people and figure that out. Or are you going to have somebody come in with some of this in their mouth, and they're going to say, I'm going to let that fall out on its own, internal resorption? I mean, and we got this implant failing, and look, they're doing endo on the tooth behind it. I saw that slide, and I said, I've got to put this in. I mean, what? I mean, and well, they've got insurance that covers root canals. Oh, I get it, So, and then, I mean, somebody's a little bit aggressive. I mean, filling these with silver points, and some kind of poster, I don't know. And then, anything that you see this, I mean, when you see this, you got to show it to the patients and say, hey, this is what you need to do. Now, this is a colored scanning electron microscope image of cytoplasmic extensions from dentin producing odontoblasts. See all the little holes there? Dental tubules. What do you think's in those holes? We clean all the decay out. Okay, we got all the decay out. We got the Explorer. We're scratching that. We take a picture of it with one of the lasers to see if there's any decay left in there, and looks good. But what's really down there? There's the dental tubule. Look at this. Now, you're going to rinse that off. You're going to put stuff on there. You're going to seal it. And 5 years later, you see decay under your restoration. How could that happen? They're anaerobic, and you just sealed them in there. It's party time, okay? So a lot of times we see, oh my gosh, look, the dentist before me left decay under that tooth. Probably not. He probably cleaned it out or did a pretty decent job of cleaning it out. What he didn't clean out was what was causing the decay in the first place, which is the bacteria. So now when you put ozone gas on there, the gas is negatively charged. All of these microbes in here are positively charged, okay? It'll attract the gas right to them, and it blows up their cell membranes. Then when you do that, you get a sealing off in here because it's like an ablation effect, like when you ablate a nerve in the body, or it's an oxidative effect. You're burning that over, and you're having your organic material inside the tooth seal off. Because when you put ozone on a tooth, on the bacteria, here's what happens. They've got all this nice biofilm running around in the dental tubule, and they're all in there, and they're all comfy, and they're saying, hey, we don't have to worry about anything. They're going to put a filling over us in a minute, and then, we may have lost George and Sophie, but, hey, we've still got Carl and all the rest of the boys down here, and the band's ready to play as soon as they cover us up, and there's no oxygen coming in on us. But look what happens. This is just seconds after applying ozone on there. Look at, they're just blowing up. When they blow up like that, the white blood cells can now come up and phagocytize them and take that antigenic component of the cell membrane of the bacteria and take it to the immune system to identify it and make a nice antibody which will kill those guys. And it's a chain reaction because once the ozone breaks that one down, it forms a lipo and a hydroperoxide. Those are toxic to the bacteria next to it. And then it breaks that one down. And that forms more lipo and hydroperoxides. It breaks that one down. So you need a very little ozone to do that. Most of the ozone treatments we do, you're 99.95% oxygen, 0.5% ozone. That's all it takes, 50 micrograms per milliliter to kick that reaction off like that. And the ozone's gone in seconds. It's not there anymore because it breaks down, but the byproducts of it, the lipoperoxides, they'll run on for several hours to days. And remember, don't forget to look back here. these are really some bad boys sometimes. I mean, you know, you look back there and you say, oh, I'm cleaning the mouth up, and then you, we might have a problem here. And so you can inject those with ozone gas, and they'll suck right down a lot of times. If you get them young enough and they're not too sclerotic, you can do that. If they're not too hypertrophied, you can do that. But sometimes they're so big, you just got to go ahead and let an ENT take, you know, laser and debulk those and take away the large amount of the tissue. You never take the tonsils all the way out. The fingers of the tonsils embed into the lateral pharyngeal walls, and the lateral pharyngeal walls are connected to the GI tract because you're giving the immune system in the GI tract information with whatever you're eating and whatever you're drinking that's going past the tonsils. So even though they say, oh, I had my tonsils removed, there's still tonsil tissue in there. So yeah, it's nothing. My daughter was 9 years old, my middle daughter, and her tonsils were big like that, huge. And so our pediatrician said, we're going to need to get the tonsils out. And so my daughter's not the best patient in the world. So I said, okay. And so I said, you're going to have to go get the tonsils out, and when they're going to put you to sleep. And all. I don't want to do that. And I, well, you know, you have to do that. You really don't have any choice. And she said, well, you do other people, and you can do ozone on them. I said, yeah. She said, well, I want to do that. And I said, okay. So I have her gargling ozonated water and doing some other stuff. And I said, okay, they're a little bit better, but we need to inject ozone in there. And she said, she's a needle phobe, okay? And I mean, just doing a filling on her was like so traumatic. I probably lost 3 layers of linings in my stomach that day. But anyway, so I told her, okay, I can inject those. And she said, will it hurt? And I said, it usually stings a little bit, but then it's gone pretty fast. She said, okay, I don't want to go to the hospital. I said, well, that's a smart move, but we'll go ahead and do that. So small gauge needle, 30 gauge needle, 1-inch needle, 5 cc syringe, because you need a small syringe so you can see around it to stick them. Bump, went right there, bump, superior pole, put a milliliter and a half ozone in there, and she went, swallowed really hard, and I said, how was that? And she said, oh, not too bad, but do the other side. I want to do that, but would you do it really fast? And so I did. 3 treatments, tonsils went down. Long story even longer, she calls me and bringing a friend of hers home from college 9 years later. Her friend, I'd met the parents at college. His dad was a lawyer. She comes home. Katie's tonsils are a mess. She wants me to inject her tonsils. I said, well, no, I'll call your dad. So I called her dad and I said, hey, Katie's here. He said, yeah, no, she told me she comes home. I said, well, you know, I want to clear it with you before I do this. He said, you can do anything you want to. Katie's 18. She can make her own mind up. I said, she's always your daughter, and you're a lawyer. And so was my dad, and so was my brother, and so was my daughter. You know, so I said, I want to clear this with you. He said, Bob, I'm good to go with that. So she came back 3 times between Thanksgiving and I came home Thanksgiving the first time. I injected him once over Christmas and once somewhere in January, February. Done. She was good too. So it does work. But sometimes when it doesn't work, you've got to say, okay, you need to get these out. So that's just to keep that in mind. And we want to avoid that. Why do they come in and look like that? I mean, you know, the hygiene doesn't look bad, but when you go to the bottom of those pockets and pull out, you'll pull out some like stringy little plaque stuff down in the base of that pocket. How do you get that out of there? There's only one way to get it out. You've got to use an oxidative agent to get it out. So you've got to say, what's the treatment plan on these people then? Well, how are we going to treat these patients with their medical dental issues? What's first? Are we going to get the dental revision and do all the fillings out first? Are we going to chelate them? Are we going to do herbs? Are we going to detox? How drainage of their organs? Are we going to give them supplements to build them back up? What other treatments are available? Well, I start by detoxing them. And I'll just go in and I'll say, okay, here's what we want to do. We want to get you back healing. And so what we have to do is we're going to give you some drainage remedies here, and we're going to support your immune system, and then we're going to give you stuff like bone broth to build you back up, and some probiotic yogurt, because we want to get to here, but we got to go through here to get to here. And there's EDTA if we're going to chelate them, if they got a lot of mercury in their system. And so this is what I've done lately. Just in the last year or so, I've really evaluated the thymus, and so I'm giving them Thymax from Standard Process. One of my patients brought in Allergies Research's product, which is a thymus thing, and then we also hit them with vitamin D3, about 10,000 a day, zinc, which you'll see why in a minute, and some prebiotic greens, which will build up their gut again, and vitamin C, the lithospheric vitamin C. Dr. Levy's here, I think, today or tomorrow with that booth. And then I like this one right now from Douglas. It's Endocrine Complete. It really will help build up all the endocrine glands in your system. And so then I want to take all areas of infection and disinfect the treated areas with ozonated water and ozone gas. So, that's no problem there unless it gets really deep. Little perio abscess there. You might find some popcorn or something down there. And, these, we used to spend a lot of time. I can't tell you how much time Phil and I spent trying to retreat root canal teeth. It just has not been successful, not at all. And so when I see them like that, I just say, you can't keep that one. You just got to get that one out. And, PA abscesses, do you want to incise and drain that? If you get them right early like that and you treat them properly with endodontic treatment, Val Cantor treats them with ozone water and a laser and does all these PIPs and sweeps treatment. You need to look at that if you want to continue to do root canal treatment. And there's an osteonecrotic lesion, but what's it associated with? Oops, somebody left a root tip there. Okay, so you've got to look at all these things and get them out of there. So, like Phil was talking earlier about the way that the infection is in your mouth. This guy comes from down in Kentucky. A buddy of mine sent him up. He had a root canal here. We'd ozonated that root canal. Everything was fine. He came back about a year later. He's swollen on the left side. Don can't figure out what's wrong, and he says, would you check him again? I think the root canal is going bad. So he comes up. We take a PA. This tooth looks really bad. So I numbed him up here, took a 1/2-inch 30-gauge needle, it's got to be short, and started taking it and just poking it, looking for, a little area where it's going to abscess. I couldn't find anything. So it happened before I'd found him on the palate, but I never had a really good picture. So I said, Ron, to get the camera, we might have something going here. So I found this. This is right here. It's between 12 and 13, okay? The needle is all the way to the hub. That's a 1/2-inch needle. It's buried. Watch where the pus comes out. That's ozone gas right here. So we inject the ozone gas and, sure, look where the pus comes out. The buccal of 15. How did the gas get from there to there? That's a pretty big defect in there. So if you see that normally, you'd say, okay, well, then we take out this tooth and grind out all the bone, take out that tooth, grind out all the bone, take out that tooth, grind out. You're going to grind all this bone away. Now you've created a dental cripple. You don't have anything to restore. What if we can get these teeth fixed and have some restorable ridge there? Maybe all endo teeth aren't going to last forever. Maybe none of them will last forever. But, you've got to give it at least a chance, especially when you treat them using ozone. So again, there's ozone germicidal, biocidal behavior because it's killing all the microbes. Boom, boom, breaks them down. The biofilm breaks down, and out comes the pus. So, dental revision now. So now we're in step 3. Okay, we're going to remove all the toxic restorative materials and replace them with composite or, lithium disilica crowns, zirconia crowns, something that the patient will tolerate. Okay, and then on those patients that have those really loose teeth, you can't let them brux on those at night. You just can't do it. So for years I was making upper lower flat plane splints. Like Dr. Cole was telling you, I taught TMD for 17 years for Academy of Craniofacial Pain, and so we developed a lot of stuff like that. Now I'm tending to go more with almost like the sleep apnea appliances for them. They seem to be more stable. They last better. They don't grind on them as much because they have a limited range of motion there where they can come anterior, posteriorly on that herpes bar, and they have some lateral movement in there. So that's kind of my treatment plan for treating those really refractive perio patients. So what are we going to talk about? The biocompatibility of periodontal treatment. Number 4, okay? So we want to disinfect the mouth and eliminate periodontal pathogens. Oxygen and ozone. That's why we call it oxygen and ozone, because like we said, it's 99% oxygen, way less than 1% ozone. To remove as little healthy tissue as possible, and to remove calculus deposits to get access to the base of the pockets. If you don't get that off, you're not going to break the biofilm down and get rid of the bacteria, which are hijacking the immune system, which is causing the bone loss and the recession of the gingiva. And we want to ensure that the patient's lifestyle is conducive to good oral health. They've got to, eat right. They've got to stop smoking and cut down, on the booze. Or like this one girl that was a college student, came back. I'd been treating her since she was 10 years old. She comes in, she's 19, and she called from college and says, I've got 14 cavities I need filled. I said, run from that dentist right now. Don't even go back, come home. They're just trying to do stuff you don't need. No, she didn't have 14 cavities. She had 17. She was studying and holding Mountain Dew in her mouth while she studied. She had class 5 decay all around and interproximal in several areas. So, so you got to know what are they doing, And so here's the ozone machine, and so what we use it's just the one from Longevity. You got to be careful of the ozone machines you get. You want to make sure they don't have any metal parts in contact with the ozone machine, in the ozone stream rather. Silicone tubes, Kynar fittings, and glass. That's all should contact ozone. If you see metal ports on machines, they're not. That's not an ozone machine. I say they're made in the USA. Most of them are assembled in the USA. This one's in Canada. And you need an ozone monitor in your room to make sure nothing is leaking. Because every once in a while, we'll be out and you'll hear, this thing's going off. We're not even using an ozone machine. What's going on? It's going in the destructor. No, we had a tube break here, so something's leaking out. So ozone monitors is a safe thing to have in there. And look at the back of a machine if you look at any, and this is the back of the Longevity machine. I can get this to work here again. Oh, now, shoot. So what you want to see is this. You want to see these certifications. Anybody can get that little CE certification. You just have to pay for it. But this certifies that the machine meets safety requirements. And safety requirements means that they have product liability insurance, which means that if anything would ever happen and somebody would think it was your fault, then you can say, oh, no, this machine is good. It's certified. So, and go into a lot of those weird things that happen. But anyway, periodontal therapy procedure, comprehensive diagnosis. We look at that under a microscope, and the treatment cycle is dependent on the patient. So we go in and do growth scaling. We use an antimicrobial agent in our piezo's and in our ultrasonics, which is ozonated water. Okay? So, and then when you do that, and you're using an ultrasonic on this, think about all of the aerosol you're creating, and you're breathing it, okay? So you can have them pre-rinse with ozonated water, 30, 45 seconds, 2 times, no bacteria left in the mouth. You put it in your reservoirs of your scalers, there it's killed. Put them in your water bottles, ozone in your unit water bottles, no biofilm in your line. And you're spraying your 3-way syringe and your high-speed handpiece, putting out ozonated water. Couldn't be better than that. So then we're going to go down and rinse out the pockets, okay? And we're going to go in and rinse out all the pockets with ozonated water. And there's multiple ways that we can do it, but we want to do this because there's biofilm down there, okay? And in the Journal of the American Dental Association, periodontitis is an archetypical biofilm disease. And it says you can break biofilm down if these agents include oxidative agents that dissolve the biofilm matrix. Ozone does it with no residue. The other oxidative agents like bleach or iodine or any of these other things leave a residue behind that you've got to clean out. When ozone breaks down, it breaks down to water and oxygen. So, you don't have to worry about trihalomethanes from chlorine. So you put bacterial exposure to ozonated water, only 4 micrograms per milliliter. So that's 99.99% oxygen, and 0.4% ozone. I mean, so, you know, it's nothing. But look what it does. Boom, distilled water, they're growing fine. Ozonated water, it starts rounding them up, breaking the membranes down, they fall apart. Same thing in your lines, in your water lines or any dental plaque. 2 minutes, boom, it's gone. Shoot. So then secondarily, we'll come in and come back and fine scale and check all the pockets and ozonate them again. Really, you want to avoid any of the aggressive root planing on these cases. And, you know, my hygienist is really good at that, just getting everything off gently and with the various and sundry ultrasonics that we use. So the integrative approach to the patient becomes the co-therapist. So I tell everybody, look, you come in here and you say, fix me. I can't fix you unless you help me. You know, I can't keep your car running if you're going to drive it badly. I can't keep your car running if you're going to go put terrible gas in it. You know, I can't keep your car running if you don't change the oil. Okay? That's a good metaphor for your patient, just because they understand cars. And so, but the critical area, like I'm just saying, is proper home care. What are they doing when they're not in the office? You know, the hygiene, we reinforce that, and we give them all the things they need, toothbrushes, proxy brushes, everything like that. But the patient has to be in like part of the solution and not the problem. So we give them all the stuff. You know, out of Perio-Clear, I usually give them ozonated water to take home. I give them ozonated olive oil to take home, and give them proxy brushes and different things. A tooth and gum tonic is another option there. And when you irrigate, I always tell them, look, irrigation isn't going, Irrigation is blowing it out with a water pick in your shower, or this is a new water flosser toothbrush from Waterpik. And those really do work. So, you know, I don't get anything from Waterpik, but I mean, I'll tell you what, the patients really love those, and my whole staff loves them. They did a lunch and learn day for us one day, and then you get some kind of a discount. So if you ever talk to the Waterpik people, have them buy you lunch, and then you'll get a discount. You're shaking your head knowingly? Yeah, okay. So, so home care and supplementation. So my patients, all the woo-woos like Phil was talking about, they all like oil pulling. That's fine with me. You know, I do it. I don't do it a lot. I don't really need it. Vitamins and minerals, I always talk about the traces. When you talk about bony support, you want to build up the bone, but you don't want to use calcium because calcium is going to be damaging sometimes. So I use horsetail tea. It has a high level of salicylic acid in it, which is a precursor to calcium, so it only makes the amount of calcium that you need. So you don't have an overabundance of calcium. Back it up with magnesium, D3, and K2, and you can rebuild bone. Then healing, stimulating your ginseng and peppermint tea. You can make poultices. Some of the people do that out of yellow root, myrrh tea, tree oil. You can do anti-inflammatories. You know, most of my patients are big on turmeric, and then antioxidants. Green tea works really well. So anti-inflammatory diet. Like, who said that earlier? Griffin? Green vegetables, colorful vegetables, that will absolutely give you an alkaline pH in your mouth, you know, and the oils, coconut and olive oil, definitely, you know. So, and, you know, certain nuts are good for us too. But an anti-inflammatory diet, you can find that on the internet. There's a bunch of those. Xylitol is my go-to thing with all the kids. We give them xylitol toothpaste. We give them xylitol chewing gum, and I don't have suckers on there. We give them xylitol suckers. At the time they get their teeth cleaned, the mothers go, oh, that's a xylitol sucker, you know. And because what happens is it's an alcohol sugar. So the science behind this is the bacteria think it's sugar, and they eat it. But it's an alcohol sugar, so it kills them, okay? Now, it'll kill other bacteria, so you can't consume a lot of xylitol. Mannitol is, you don't want to do much at all because what it does, it kills the good bacteria in your gut and then you get diarrhea. So just don't give the kids a lot of xylitol. But it does work really well. And classic home care, you know, a lot of my patients are the real down home, grow their own food and everything, make their own whiskey, and they brush their teeth with salt and baking soda because that's what their mother did, and that's what their grandmother did, and that's what their great-grandmother did. And that's a really fine way to do that. You just mix it up in the palm of your hand. The bottom line is, if they don't clean their mouth, nothing we do is going to work, okay? So on the subsequent appointments, basically what we do is reevaluate the effectiveness and treatment compliance with home care. And, a lot of times when we do this, they might come in 2 times, they might come in 6 times, but we've got to get them to where they're not bleeding and where Sarah comes in and says, they get a gold star today. So we have a thing in the office where we got gold stars like you used to get in grade school. And when they do well and they get a good cleaning appointment with no cavities, and the gums look good, we put a gold star on their chart. And that's really weird, but do I get a gold star today? Yeah, you get a gold star today, yay. So the initial therapy endpoint is when you don't see any risk factors in there. They're not bleeding, everything looks good, and although they might have 4 or 5 millimeter pockets, if they're not bleeding, leave those alone. They're probably going to heal now, okay? Just keep them on normal home care and don't go down there and get real aggressive with them. So maintenance, its frequency is based on clinical and microbial outcomes, but normally it's a customized thing. But on the perio cases, we're seeing them at 3 months. And if there's really a continued risk and they're still having some bleeding and issues, we'll get them in 2 months or less. But it's really individualized. And then I've got a couple periodontists in my area that are really good guys that are really ethical, and they don't treat people if they don't need it. And they both do the LANAP procedures with the laser assistant. So, which is good. And then imagine if we were going to just heal everything with ozone and water, because it's going to effectively eliminate bacteria, fungus, virus, and parasites, no toxic side effects. Here's how we deliver it. We're going to irrigate with ozonated water, irrigate the pockets. We're going to insufflate, means to blow into. We're going to blow gas into the periodontal pockets. We're going to infuse, which is inject, into the soft tissue. And we're going to saturate the whole mouth with ozone trays. And we're going to use ozonated olive oil too. So ozone is produced by antibodies during bacterial killing and inflammation. Scripps Institute, La Jolla, California. We're all making ozone in our bodies right now. Okay? Here's the pathway you're making it by. Phagocyte oxidase comes across here. Myeloperoxidase comes here. Remember what I told you about zinc earlier? Without zinc, you can't activate immunoglobulin G, and that produces hydrogen peroxide and ozone. And here's a bacteria that's being broken down by ozone, and these are all the lipoperoxides coming off that hole that the ozone blew in there. So blow gas down into the sulcus, take your ozone machine, hook it up. It's got a little perio attachment on there, a foot pedal, put it under the gum line, just blow gas up in there for a while, go around your tooth, just circumferentially. So if you got individualized pockets, this is a real good treatment. But what if you don't have individualized pocket? What if you've got a lot of pockets? Get custom trays made for them, and the ozone gas goes in here. It runs all around through the tray. It comes out here. Very low suction. It's hooked to a saliva ejector here, and you put another saliva ejector in the mouth just to scavenge any escaping ozone. And so you need to restore the microbiome in the mouth with good stuff. If you're killing everything in there with ozone, you're going to restore it. So just take some normal probiotics, grind them up if you want to, mix them with saline. You can also have them chew them up, swish them around if you don't have the saline. But just give them something that's going to get the bacteria growing in there again. And then this is the injection thing we're talking about, stimulate the re-regulation of the periodontal vascular plexus. Also, when you inject ozone subcutaneously like that, you're going to support lymphatic drainage, and you're going to produce nitric oxide, which increases the blood vessels opening up. And when you inject it, you got 3 sites right by the second molar, on either side of the mental foramen, and then posterior superior alveolar, middle superior alveolar, anterior superior alveolar. Think where the blood supply is when you're injecting, and when you're injecting that, make sure you've got a unit that's not putting in metal particles and plastic and stuff from the inside of the machine. And so there's your periodontal blood supply. So when you inject down in here, the ozone gas comes up over here and reoxygenates and kills everything, all the pathogens that are in there. And the capillary loops of oral epithelium look like that. That's what we're treating and opening up. And you grow what you are. And so you've got to tell the patients they've got to be hydrated, and it's not coffee, it's not bourbon. You got to be hydrated. I mean, bourbon's not bad, but you got to be hydrated. And you got to have good habits at home and take care of everything. Get good sleep, take the right supplements. Make sure you're living in an environment. If you're living like in a basement because you can't live anywhere else because you don't have a job or something and it's moldy down there, you're in trouble. Okay? Make sure your environment is good because you need whole body hygiene. And
Perfect timing.
it's 5 o'clock.
It's perfect. It's perfect. Thank you, Dr. Harris. That was awesome.
Thanks, son.
So I know you got questions. Honestly, you guys are probably tired, right? Long day? No, you're just waking up? Okay. Well, let's just do 2 questions. That's it. And I say that because Phil and Bob have a booth here, okay? So you can go the next 2 days, ask them whatever you want about ozone. They teach ozone. So for those of you who aren't, and you're looking at this, yeah, he keeps talking about ozone. I don't even do that. You can learn that in a weekend. It's pretty amazing.
Okay, one question. So is this something that has to be administered by the dentist, or can that be done by the auxiliaries?
It depends on the state you're in. Okay. Have an office.
What about Canada?
Canada? I'd move.
No, that's, yeah, you snuck in 2.
No,
Is
no.
it? No, you don't get it.
In Kentucky and Indiana, hygienists can inject anesthesia. They can also do the ozone treatments. My assistants do a lot of the treatment with ozone, like when we talked earlier about desensitizing teeth, when Dr. Cole talked about that in his thing. That's an amazing thing. Somebody comes in with a sensitive tooth like that, you fill a 10 cc syringe up, put a flowable composite tip on, put 60 micrograms per milliliter of ozone in the syringe, and you hold it up at the gum line, and you go over that real slowly. Before you do that, either blow air on there or give them a drink of cold water. And then when that happened, when you see that happen to the patient, it's unbelievable, because what they'll do is they can't believe it because they can put air or water on there right away. Was it at your office that we did your assistant?
Yeah.
Yeah. She couldn't eat ice cream for how long? 8, 10 years. We treated her sensitive teeth.